Okay. So everybody, so they have actually, everybody has finished their cases. So we are going to start from case number 1. I hope, are you done, online students? All the cases?
They're not replying. Yeah, they're saying yes.
Okay. So now we are going to start with case number 1. And from the class, I will ask who is going to present case number 1. Which group is going to present case number 1?
You can go by groups. It's called.
Should we? Okay, let's start from this side. So case number 1. So you have to read the case. If anybody who is reading, please come here.
Yeah. So whoever wants to volunteer has to come up to the podium.
Just read the case. That's all. So
you have to come here.
Yeah. And then if she is reading, it is not necessary that she is going to answer it. If you don't want to come here, just stand here and
Okay, so we have a 27-year-old man. He presents with chest pain, fever, general malaise. Okay. In his left antecubital fossa are needle tracts with pus draining from a 2 centimeter erythromatus fluctuant and tender subcutaneous nodule. His lab showed a WBC count of 17,400 with 72% of neutrophils, 8% bonds, 16% lymphocytes, and 4% monocytes. Despite appropriate antibiotics, he dies of sepsis and pulmonary failure. His chest X-ray is shown, and an autopsy was performed, and his lung is also shown. So the first question says that what are your findings in the gross specimen and microscopic picture?
Okay, so you have gross and microscopic both, right? So what do you see in gross picture first? Gross specific. So how will you define?
So we said that this is happened because of.
I would like to come here and say, because I want every student who is online listen to you. Not necessary that you should come here. Actually, you can even.
Yeah. Can we call all their group over here so they can?
No, I think one by one,
okay,
so that it will be, anybody who is going to explain should come here, and then that's why I was asking about the mic.
Yeah, true.
So there should be one mic here.
Yeah, well, we don't have. This is the only one.
In that class, we had mic also. So that would have been better if we had that.
Okay. Oh yeah, that's a good idea too. Yeah.
Sorry?
Yeah, they can go to Zoom from their phone.
They can open the Zoom. Oh, okay, that's fine. If everybody can listen to you, that will be fine.
Oh, okay, it's okay. Let's see what happens and then we can.
So I think then you should all on your Zoom. And then whoever is answering the question should use their Zoom so that every person online can hear you. So I want a collaboration with in-house and out-house students. Okay.
Yeah, true. So everyone over here in class, just mute your computer. Oh yeah, true. We'll see. Turn the sound off. Try speaking.
Well.
Okay.
So we said that this is started with an acute inflammation by a pathogen kind of bacteria of invasion, and this causes an abscess. Abscess is one kind of suppurative necrosis, suppurative acute inflammation. Yeah, it started with acute inflammation. One type is suppurative inflammation. It is kind of pus secretion, but if this happened in deep inside the organs or deep inside the tissue, not in like superficial tissue, this will cause an abscess. So basically, abscess is a pus that in deep inside the organs. Uh, Pus is like a collection of necrotic debris of cells plus the dying neutrophils or fighting neutrophils. So it is a sign of defense mechanism. The body is trying to defend from the invading pathogen. So the abscess is basically, if you look at the microscopic picture, we can see that in the middle it's composed of necrotic tissue. It is kind of liquefactive necrosis. Liquefactive necrosis means that the neutrophils has already killed the pathogen, or it is killing the pathogen, and it causes the surrounding cells to be degraded completely. So this is why it is liquefactive necrosis. Then surrounding the liquefactive necrosis, we have the polymorph nuclear cells, which is neutrophils. And then surrounding the neutrophils, if this persists for a long time, we're gonna have granulation, which is blood vessels and fibroblasts. Why we would have blood vessels and fibroblasts? Because the body, if this continues for a long time, the body will try to like trap the inflammation, trap the pathogen from traveling from one place in the body to other. So this is why we have granulation to trap the pathogen, trap the inflammation.
Okay, so if I ask you to discuss something regarding the gross picture, what will you say?
So I'll see multiple abscesses, multiple no collection of pus,
Consolidations. Okay.
yeah. And yeah, this is because this has happened in multiple places inside the lungs. This is why he died from the pulmonary failure.
Good. So you all can listen me, right?
Yeah.
I don't have to on this mic.
No, that's speaker, so that's good. The
Okay.
mic is over here.
No, because I have off from here.
That's okay.
That's okay.
Yeah.
So all online student can hear me, right? Okay. Question number 2. Suggest the pathophysiological mechanism for the clinical finding. How this patient has developed pneumonia or consolidation. So what is the pathophysiology? How it reaches there? Anybody from group this? And if you are not able to answer, then it will be thrown to other student. No, I want some other girl. You can give your telephone to her. No problem. Anybody else? Because I want everybody to be involved in this process.
So any girl from this group?
Yes, this group.
So basically, he was infected with the Mycobacterium pyogenic bacteria causing the pneumonia. And then this pyogenic bacteria was traveled to the lungs.
How?
By the airways.
Airways.
Yes.
See the case again. Yes. Yes. So how it reaches there?
From
So what do you think if somebody has multiple needle pricks on the cubital fossa?
From the blood.
So this patient is basically drug user. Go ahead, start doing. Come up. Yes. I'm talking to you. Yes. Yes. About this case. Question number 2. No? Go ahead. So
So I think that he was drug user, and then the bacteria traveled because through the blood to the and reached the lungs,
How?
and then
What is the route of going there? Just think, just think. It's a vein, right? This is
Yes.
not an artery. So from here, the blood will go first where? To the
That's
heart,
right.
right? Right
Yeah,
side
it's
of the
gonna
heart. And then from right side, it will go to the lungs. Yes. So you have to go to have a full picture of it. Okay. Then in the
then
lungs, it can
spread and makes the
spread and involve
multiple areas of
multiple
the
areas.
and then the infection will cause the inflammation, and then it will cause the multiple the different
Okay.
neutrophils
So
and the
it will not only involve the lung, but also possibility that it can also involve the heart, right? So involving heart and lung probably is a cause of his death, right? If you'll go, because the blood from the vein go to the right side of the heart, and then from right side of the heart goes to the lung. So it might have involved the walls of the heart.
myocarditis.
Exactly. Endocarditis, right? Alveolar inflammation also, right?
Yes.
And then this inflammation plus the pulmonary inflammation, as she has already discussed, both of them might have caused death of this patient. And the organism might be a very virulent one. Okay, question number 3. Explain the peripheral blood finding. Anybody else from this group? Yes. What is the WBC count here? Yes.
So
I want somebody else to discuss. Anybody? Why are you shy?
WBCs here are elevated.
Yes. Not 7,000. It is
17 or
17,400, right? And how much neutrophils?
72%.
And
They are normal.
they are normal.
no, the percentage.
What is the normal percentage of neutrophil in body?
60 to 75.
And how much here? 72%. And also 8% band. What is this 8% band? They are immature neutrophils. So why these immature neutrophils are coming here?
Because the blood signals to the bone.
Exactly. Because now the cycle is going on very fast. They need more and more WBCs or neutrophils to come there. So bone marrow is starting making more and more neutrophils. So normally it takes little time to mature that neutrophil. And if you need that neutrophil very urgently, what will happen?
All the immature
Probably
and
some of the immature neutrophil will also come to set a combat with that bacteria, right? So these are the band cells, which are actually immature neutrophils. They came out to help them, and this type of neutrophilia is called shift to the left. Shift to the left when some immature neutrophils come up. Okay, good. Question number 4, or probably I think it's misnumbered. So the last question. The chest pain experienced by this patient is predominantly the result of which chemical mediator?
bradykinin and
Prostaglandin.
glandin E2 and bradykinin.
Okay, and bradykinin. Good. So these are the chemical mediators which cause pain.
Okay.
Very nice. Any questions from the class, or any question from online students? Yes, sure. Please open the mic. Okay. Yes.
I'm muting.
Okay. So anybody from the online student, any question? So there is no question. Should we move to question number 2? Case number 2?
You're asking question three. Could you?
Question number 3. Okay, so just to repeat that one, as patient had inflammation because of that, he was a chronic drug abuser, and he has infection on the cubital fossa. So from cubital fossa, the infections goes up through the veins into the right side of the heart first, and from sides of the heart, it then travel to the lung. So it has involved multiple areas in the lung, as you have seen in the picture. So there are multiple consolidation here. And even if you see in the X-ray chest, so in the X-ray chest, what is this? This is abscess. So if you are standing like this, because it's a liquefaction necrosis, so you can see liquid will go down, right? So this is a typical sign of liquefaction necrosis. Okay. So then, because it has been infected more, you need more and more neutrophils to come there. And for that, they had to make neutrophils. So they need little time to develop. And because they need it urgently, so some of the immature neutrophil can come in the blood, right? To help to overcome that infection. So this is called some of the band cells. So immature neutrophils will be there, and this is called shift to the left, because to overcome with these infections. Is it clear now? Okay. Now coming to case number 2. So I will ask the other group to come up and read case number 2 and answer. Case number 2.
You want someone to come up here first?
No. If